I'm Dr. Kenny Levine. Welcome back to Health Talk. We're streaming live on the web at www.tvchannel19.com. One of the joys I have in my practice is working not only with fine restorative dentists and prosthodontists, but working with other dental specialists. And I have tremendous interaction with orthodontists. I'm here tonight with Dr. Jay Singer. Jay is an orthodontist, and Jay is an incredibly talented doctor, a good friend, and someone who I know personally. Jay, welcome to the show.
Hey, thanks for inviting me, Kenny.
You know, Jay, I became a dentist. My father was a general dentist, and that was somewhat of the motivation for me. How did you get interested in dentistry?
Well, I went to the dentist. In fact, we had a neighborhood dentist, and I used to ride my bicycle to the dentist.
Where'd you grow up?
In Massapequa Park.
Okay.
And it was just a couple blocks away. He had a home office, and he had the first color television in the neighborhood. So I said, this would be a good job.
That's a great job. You get to watch television.
And then, you know, I respected what he did, and then I had orthodontics in my early teens, and that was a very positive experience, the change in orthodontics. So that was my calling.
So you went to dental school, and did you go to dental school knowing you wanted to be an orthodontist?
Well, it was in the back of my mind. I went to Emory Dental School,
right,
and I was considering ortho or perio.
Okay, we
and
could have been partners.
We could have been. Maybe you were thinking about ortho.
No, I never thought about ortho. Had to bend too many wires.
Yes, well, there's some wire bending in it, that's for sure.
Right.
But I decided on ortho, and I'm glad I did. I've been doing it for 30 years, 32 years, and I've enjoyed every minute of it.
So you went to Emory Dental School, and where did you do your ortho training?
Fairleigh, went back up north to New Jersey, Fairleigh Dickinson
right.
in New Jersey, and I had 2 years there in my postgraduate program, and practiced there for a little bit, and then decided to come to Florida.
Well, you're sort of a renaissance man, because you do have a tremendous hobby, avocation. Tell us a little bit about that, and I know your dad had the same thing.
Well, I have a lot of hobbies. I love to ski. My dad was a pilot, so I fly airplanes. I got interested.
You fly the planes? It's
I
not
fly
like
the
model
plane.
planes.
Not model planes. No, I'm a flight instructor. I used to teach flying in college and dental school. And in college, I took up art, and I got into first charcoal, and then pastel, and then oil painting.
You know,
I also play guitar, and I sing, and I've sung for you a few times.
You're not such a great singer.
Yeah.
You're much better orthodontist. You know, traditionally, orthodontists took care of children and teenagers. That's not so today. Tell us a little bit about how you treat adult patients.
Well, you know, it all started with Marvin Goldstein. He was one of the pioneers in adult orthodontics in the 70s. It has grown over the years. Now, today, most practices in the country, they got 25% of their practice is adult orthodontics. And with me, I've been about 30%. I think in Florida in general, most of the orthodontists that are not affiliated with pedodontists probably are treating 35% adults.
No, adults who anticipate braces on their teeth are concerned with the aesthetics of it. And there are some unique things. I know when I was a kid and I had braces, every tooth got bracketed, and so you had the silver band, and then you had the wires, and you had all contraptions. Today, my grandchildren up north have braces, and they have the bonded brackets, and they have different colors for the elastics for their sports teams, and braces are now a fashion statement among teenagers.
That's right.
But not so for adults. So talk about what you do uniquely for your adult patients.
Well, you're correct in pointing out the evolution away from full bands. Direct bonding became popular in the late 70s, right around when I was in ortho in 78 to 80, and bonding was just coming into the fore right then. Prior to that, we had to put bands on every single tooth, so you had the full rings of metal around every single tooth.
You had to make space. You had to separate.
And you had
to
put spacers, and that was uncomfortable,
right,
because you had to make space between all the teeth, and it was very time-consuming and very labor-intensive. And bonding just got better and better. Direct bonding, eliminating those full bands, so we just use a little composite bonding, which holds each bracket without the band directly on each tooth. So that was the first major cosmetic advantage for all patients, and not only cosmetic, but also much more hygienic, much less risk of a leaky band and
decay.
and decalcification. So bonding was the first big step towards more cosmetic orthodontics.
Well, there are a lot more things that you do. We're going to get into that in the next
Yes.
segment. Hold that thought, because I'm Dr. Kenny Levine. We'll be back with Health Talk in just a moment. Thank you.